Health authorities in Ghana have introduced and announced that 2 cases of the deadly Marburg virus have been identified in the country. Now, this is the first time the Ebola-like disease has been found in the West African nation. Earlier in the month, blood samples taken from 2 people in the southern Ashanti region suggested the Marburg virus. The samples were sent to the Pasteur Institute in Senegal, which confirmed the diagnosis. No treatment or vaccine exists for Marburg, which is almost as deadly as Ebola. Its symptoms include high fever, as well as internal and external bleeding. Official statements say a total of 98 people identified as contact cases are currently undergoing quarantine, noting that no other cases of Marburg had yet been detected in Ghana. According to the World Health Organization, Guinea had confirmed a single case in an outbreak declared over in September 2021. For more on this Marburg virus, we are now joined by Dr. Francis Kasolo, the country representative for the World Health Organization in Ghana. Welcome to Newsday. Thank you so much for joining us this afternoon.
Thank you very much, and it's a pleasure to be on your program.
On the heels, yes, we're glad to have you. On the heels of all these diseases that are cropping up, what exactly is Marburg disease? What is its origin? Where did it come from? How infectious and dangerous is it to our public health?
Well, thank you very much. Marburg virus belongs to the same family as the Ebola virus, and normally we refer that as the filovirus. Its origin is still out there, but what we know is that the fruit bats carry this virus, and that when the interactions with human beings occurs, there is a possibility that this particular virus will cross into human beings. What we also know is that the same virus does affect some monkeys, and again, interacting with infected monkeys may also result in human transmission. And once it's entered the human transmission, it then spreads from one person to another. We know that, for example, that up to, on an average, 50%, with a range of 24 to 80% of those that get infected with Marburg may die. And so it is one of those very serious hemorrhagic fevers, viruses, and that it's one of the most dangerous in the same family as Ebola.
So how can Marburg disease be identified in a patient? What are the symptoms to look out for?
Well, firstly, I think you may have within an individual a history of having come into contact with a person who exhibits a high fever, bleeding from the different body orifices, and then also they may have joint pains and just the general feeling unwell. But that history of having been in contact with such a person should raise the suspicion of a possibility of a hemorrhagic fever, which then can be diagnosed through the laboratory.
All right, what's the immediate medical remedies that can be adopted to help an affected patient?
Unfortunately, at the moment, we do not have what we would call the antivirals or indeed a vaccine. But however, just as previously with Ebola, we need to keep the persons, first of all, isolated, secondly, well hydrated, and then treating the symptoms that they may have. If these persons are identified early enough, the chances of survival also increases.
And for those who are healthy, for a healthy person, what are some precautions that need to be taken into account in order to prevent any type of infection?
As I mentioned, the transmission normally comes from direct contact with an infected person or fluids from an infected person. So the starting point is really not to handle these particular specimens from persons that may be infected. And you can do this obviously by the usual wearing of gloves, keeping and wearing protective masks while you are treating, if you are a health worker treating such persons. But for a healthy community person, really, it's having that index of suspicion that if you hear that there is Marburg within the community, do avoid crowding, do avoid direct contact with infected persons that may have this particular disease. It's really keeping that distance that will prevent a healthy person from contracting the Marburg virus.
Now, Dr. Kasolo, now that the virus has been identified in Ghana, would you advocate closing of borders and probably curbs on traveling to reduce the spread of this disease in the West African region?
Well, like I mentioned earlier, closing of borders would not help. I think we do not advocate as the World Health Organization closing borders during outbreaks. Rather, what we need to be doing is sharing information across borders and pulling together resources to be able to heighten our surveillance, that is, the ability to detect any cases that may cross borders. I think that's the best way of addressing such an outbreak. Closing of borders does not in itself prevent the infection from crossing borders, because as we know, the borders in most of our countries are so porous that really it's an exercise in futility.
All right, you said the Marburg is in a particular kind of family, but I want to find out from you, is Marburg worse than Ebola? And people that actually contract Marburg, can they survive it?
The first question, yes, it's comparable. The Marburg fatality rates are comparable with Ebola. And again, yes, it is something that people can survive from if they present themselves early to the health facilities so that the symptomatic care for such patients is instituted early enough. So it's very similar to Ebola, and the measures that we advocate for Ebola are also very similar to those that we advocate for the Marburg.
No, the question is it worse? You said it's similar, but is it worse than Ebola?
No, you can't say it is worse. I think the outcome of any infected person for Marburg and indeed Ebola depends on whether or not these individuals present themselves early. But if you look at the case fatality rates, they overlap with that of Ebola. So it's a range of 24 to 80% of those that are infected may die from these two conditions. So there's an overlap in terms of the case fatality. And I wouldn't say either one of them is worse than the other, but just to say that belonging from the same family, we would want that people take actions as we do with Ebola.
So with Marburg, Ebola, monkeypox, COVID, and the list of many other viruses whose names we have been hearing ad nauseum for the last couple of months, if not years, what is with all these viruses and a new one cropping up about every year? Is it just that our attention has been drawn to it more because of the devastating effects of Ebola on the continent a few years back and COVID? Or is this just a normal thing? Viruses exist and people catch them and this is just how we have to go about life? Or is there something going on more that is causing these viruses to exist?
Well, the first thing is there are many, many viruses out there. Some of them are within the human species, others are within the animal species. And so a number of factors may actually cause some of these viruses, especially those in animals, to cross over into the human species and start circulating. And some of them may just be innocent and not cause much problems, but others like the Marburgs, the COVIDs, the monkeypox may actually lead to death. And so in answering your question, one of the factors that we think is contributing to the emergence of these particular viruses is the human-animal interaction and the human encroachment into the animal habitat. So we are getting exposed as we move into, for instance, the forests. We're getting more and more exposed to viruses that were circulating just within the human population. But secondly, following the Ebola and other indeed outbreaks, the capacities for the human surveillance has improved across the continent. And therefore, we are more likely to pick up early enough some of the new emerging conditions. So it is indeed a mixture of us having the ability to detect early some of these new conditions, but also the factors contributed to our interaction with the environment and indeed the animal species.
Dr. Francis Kasolo, country representative for the World Health Organization in Ghana, thank you so much for joining us on Newsday.